both as the trolley as well as the med cart. And so before I come to the med cart, I'm going to wash my hands. I'm going to come up and I'm going to pull up the EMR, and I'm going to make sure that I'm going to look and see if my client has any medications at this time, which they do. So with that, I'm going to check which medication that they need. I'm going to unlock the med cart. I'm going to grab that medication. I'm going to make sure that it's the right medication. Yep, it's the right dose, which it is. The right route, which it is, which we're going to be administering for the nasogastric. It's the right individual, which it is, and it's the right time, which it is. I'm going to also make sure that it's not expired. And so I know that the route is going to be nasogastric, so I'm going to have to crush this pill if indicated, if not contraindicated by the pill. If it's a capsule, I'm going to open that. If it's a liquid, I'm going to pour it in. So because we're going to have to crush that pill, I'm going to take the pill. I'm going to put that pill in the pill crusher. I'm going to save the wrapping it was in. I'm going to crush the pill.
Right, but that's already trying out infection. See what I mean? Like, that's like the move's probably already done.
And I'm going to put the crushed pill inside the med cup. And then to that med cup, I will additionally put 5 to 10 milliliters of water. I'm going to make sure that the packaging for the medication stays with it. Because this is nasogastric, I'm going to make sure to have a pH to test the placement and a syringe to administer the medication. I'm also going to demonstrate insertion, so I'm going to have a glass of water for the patient to drink. So after that, I'm going to log off of the EMR. I'm going to lock the med cart, and then I'm going to transport the medication in the client's room. I'm going to provide privacy. Hand sanitation. Introduce myself. My name is Cam. I'll be your nurse today. Can you give me your name? His name is Jim. And I'm going to check Jim's identification band. Ask Jim for his birthday, which he gives me, which checks out to make sure that we have 2 client identifiers. Today, what we are going to be doing is doing medication administration for nasogastric. We're going to put some medication through your feeding tube here. Jim already has a feeding tube, and so I'm going to demonstrate what would happen if he didn't have one. So I'm going to make sure that the bed's in working height for me. And that Jim is leaned forward. Now we can't go all the way forward for this because we have a makeshift stomach, and so we would have him a lot higher than this, but we're not going to have him that high for this demonstration. And so I would do in hygiene, I've done gloves, and I'd have the nasogastric tube. And I'm going to measure the nasogastric tube from the tip of his ear to the tip of his nose, and from the tip of his nose to the xiphoid process. I'm going to mark that indication to know how far down I have to go. And I'm going to give Jim some water, and I'm going to instruct Jim that to sip on that water. And every time he sips, I'm going to insert the tube. So I'm going to make sure that I have the tube going down the appropriate nair, which is going to be the bigger of the two. So every time he sips, I'm going to insert it until there's no insertion, there's nothing left, or it's to the point where I had previously indicated. And so now that it is inserted, I have to make sure that the placement is correct. So first, what I'm going to do is ask for permission, of course, to expose his abdomen, because I need to listen to bowel sounds. I need to make sure that his stomach is working properly. And so I'm going to start at his lower right, go up to his upper right, upper left, to lower left. I'm just listening for normal gastric sounds, making sure that everything's working properly, or working as it should be. Tell Jim that they sound fine. And now what we're going to have to do is check placement. Now checking for placement is done both post insertion of the tubing and prior to administering medication. So from now on, I will be going back to medication administration. So again, because I wouldn't be inserting it now, I would do hand sanitize and don gloves, and instruct the client that we are going to be first testing where the tube is. And so to do that, we're going to have to withdraw some liquid from the tube, and then we're going to test the pH of that liquid to make sure that it's in the right spot. And so what we are going to do is withdraw 30 milliliters of air. We're going to clamp, unplug, insert, and push in 30 mils of air down the tube. And now we're going to withdraw 10 to 15 milliliters of liquid from the tube that we will take to test to see where it is coming from. So withdraw, I'm going to pinch. I'm going to take out the syringe. I'm going to put it in there. Now, if you did have a continuous feeding tube, I would turn that off and flush the tube. So now that I have the specimen, I would test this, but for this demonstration, we have these two basins that we're going to test instead. And so I'm going to grab two pH strips to demonstrate two different pHs. pH1, pH2. And I would take the specimen from the liquid that we had taken out via the tube, and I would place a drop on this paper here, and then I will look at the pH and compare to where the paper is. So this first one is a pH of 8. Now a pH of 8 would be right about in the intestines, because intestines would be about 7 pH or higher. And so the second one is about a pH of 4 or 5, which is exactly what you want to have in the stomach. You want 5 or less, unless they're on antacids, would be 4 or 6. And now that we have tested that it is in the right place, which would be the second one with 5 or less pH, and we want to see like brown or maybe bloody, brownish tinge to it. And so now that we know that's the right place, we're going to administer the medication. To administer the medication, we're going to need the plunger, and we're going to flush and administer everything per gravity. So we need the syringe. We don't need the plunger. And so for that, I'm going to pinch the client's tube, place the plunger. I would administer the medication, and I would let it flush. And if I need to administer another medication, I would do 5 to 10 milliliters of water before the administration of the second medication. If not, I will flush it completely with 30 to 60 milliliters of water. Now that the medication is flushed, I'm going to pinch, I'm going to disconnect, I'm going to replunge the tube, before I would administer the medication, I would check the packaging of the medication and make sure that once or for the third and final time, that it is the right medication to give the client at that specific time and with that specific route. Now that medication has been administered, now again the client would be resting a lot more forward, closer to 90, while this medication is being administered and while the tube is being inserted. Because of this demonstration, we cannot do that. And so now that we are done with everything, we are going to make sure, I'm going to doff gloves, and make sure that the client is in a good position, but still above 30 degrees. That he's still in 30 degrees, just to make sure that he's not aspirating. I'm going to ask the client if he needs anything else from me. If he doesn't, I'm going to do hand hygiene. I'm going to put his call light. I'm going to put that right next to him. I'm going to remove the privacy. I guess additionally what I should mention is that I would be checking more for any sort of allergies, both for the insertion of the nasogastric tube or the medication administration, to make sure that nothing is contraindicated for that specific client. Now that I've done all that, I'm going to make sure to get out of there. And then once I'm out of there, I'm going to make sure to document everything that I did with that client.